Hi, and welcome to this podcast, the IELTS, OET, and UKMLA PLAB 2 Made Easy podcast for medical professionals. My name is Kalsoom, and I specialize in training doctors and nurses to get the score they need in IELTS and OET, and also training doctors on how to improve their clinical communication skills for UKMLA PLAB 2. The aim of this podcast is to arm you with authentic advice from someone who has been teaching these tests, especially IELTS and OET, for over 10 years. I share the core fundamentals of these tests, the essential information, strategies, and advice on what you should be doing and what you need to avoid doing. Anything and everything to make sure you keep moving forward in your preparation and getting you closer to achieving your scores and getting your dream job abroad. I understand and appreciate that your time is busy as medical professionals. You have very limited time, so I do try to keep the episodes short. And one of the advantages of podcasts is that you can listen on the go. So before I get into the main topic of this episode, there are a few things that I'd like to bring to your attention that you can find in the show notes. So you'll find lots of links in the show notes. And firstly, you'll find the link to my free training for OET called OET Success Training, which is a series of 5 videos that take you through all aspects of the test. And I share how you should be preparing and how you can improve your skills. And this training alone has helped so many doctors and nurses get the score they need. If you would like to train with me for OET, then you'll find the link to my flagship OET Success membership group and also a little video which explains how the training works. You'll also find a link to my free PLAB 2 Core Clinical Communication Skills webinar. This is a webinar I delivered earlier last year, where I go through the key clinical communication concepts that need to be present in any consultation. It's an invaluable resource to help you not just for your PLAB 2, but beyond the test and in your careers. If you would like to join my clinical communication mastery for UKMLA PLAB 2, then just drop me an email. This is a group training program of only 8 doctors. So I only take 8 doctors at a time, only 8 doctors in one group. This is to make sure that everybody in the group gets enough practice and feedback. So if you're interested in joining that, then just drop me an email, which leads me to the last thing. You can find my email address and how you can contact me and connect with me on LinkedIn. Hi, and welcome to this episode. So this episode is for PLAB 2 aspirants, PLAB 2 candidates who are currently preparing for the test. And this episode, we're going to talk about communication. What is communication and why is it so important for PLAB 2? So let's take a look, first of all, at what communication is. What is the definition of communication? So if you look it up, you'll come up with something like it's a process of exchanging information or ideas or thoughts and feelings between individuals or groups through verbal, non-verbal, or written or visual means. It involves a sender, a message, a medium, a way of communicating, and a receiver. And it often includes some sort of feedback to ensure the message was understood correctly, some kind of checking to make sure that the message was received and it is understood correctly. Within the context of PLAB 2, what does communication mean then? What does it mean more specifically? So in the context of PLAB 2, it assesses the clinical and communication skills of international medical students. So communication could be defined as the ability of a doctor to effectively and empathetically exchange information with patients or with relatives or with other healthcare professionals in a way that's clear, respectful, and patient-centered, and making sure, understanding, making sure that the message is understood and sharing decision making. This is good communication in the PLAB 2 setting. So this includes skills like active listening, building rapport, explaining medical information in lay terms, in everyday terms, showing empathy, and responding to patient concerns appropriately. Now, when we say communication, then, we're not just talking about speaking English fluently. And this is a common misconception. When we talk about communication, we're not talking about how well you can speak English and how fluently you can speak. We're talking about building rapport. Like I mentioned, showing empathy, responding to emotion, explaining things clearly, and involving patients in their care, all the while staying calm, structured, and professional. So in this episode, we're going to dig deep into, first of all, why communication is such a critical part of PLAB 2. Second of all, the most common mistakes candidates make. And thirdly, and most importantly, how to fix them with practical strategies that you can start using straight away. So let's begin by understanding the role of communication in this exam. So why is communication? Why does it matter so much in the PLAB 2? So as you know, PLAB 2 is an objective, structured clinical examination, an OSCE, made up of simulated patient stations. Each station is marked against 4 domains defined by the GMC. And if you know me from IELTS, if you know me from OET, you know that I place heavy emphasis on understanding, on students understanding what the marking criteria means, studying the marking criteria, studying what the examiner is looking for. And that is really the key to success, is understanding what the examiner is looking for so that you can tailor your preparation towards that, towards giving the examiner exactly what they're looking for. So let's take a moment. We're not going to go in too deeply, but everything is going to be centered around, obviously, the marking criteria. So PLAB 2 is marked against 4 key domains. The first one is data gathering, the technical and assessment skills. The second is clinical management skills. Third is the interpersonal skills. And the fourth is professionalism. Now, communication primarily falls under interpersonal skills. That's the most obvious one. But honestly, really, if you look carefully and understand what a complete consultation looks like, what a complete interaction with a patient looks like, communication shows up in all 4 of those domains. If your communication is poor, you will gather less accurate data, you will deliver ineffective management, you will lose rapport and trust by your interpersonal skills, and lastly, you would appear unprofessional. So according to the feedback from examiners and past candidates, even if your clinical diagnosis is spot on, everything medical, your medical knowledge is absolutely perfect, you cannot pass a station if your interpersonal skills are deemed inadequate. So you really need to kind of sit up and pay attention, that it's not just your medical knowledge that's being assessed. It is all of these things, and communication runs through the heart of all of the 4 domains. So let's now break down the most common communication mistakes that most candidates make and that cost candidates marks, and how you can avoid them. So the first mistake is using medical jargon too soon or too much. So what does that mean? So it's using really complicated medical terms that the patient isn't going to understand. So you jump into complex explanations using terms like congestive heart failure or duodenal ulcer or statins, assuming that the patient is going to understand all of that. Now, why is this a problem? In the UK, patient-centered care means making sure your patient actually understands what's happening. So using jargon without explaining creates confusion, and it makes you seem disconnected from the patient's level of understanding. Um, so you're not talking to the patient, you're talking at the patient. And you're not, it's okay to use the medical jargon as long as you then follow it up with an explanation that they can understand in layman's terms. So, how can you fix it? How can you avoid this problem? Well, always simplify your language. Always simplify your language and get into the habit of thinking, um, that you're explaining something to your cousin or to a friend who isn't in medicine. Um, and if once you get into that mindset of talking in that way, you will avoid using that language. Or even if you do, you know that you have to follow it up with simplified language. So, and replace jargon with plain English. Instead of you have gastritis, say it looks like the lining of your stomach is irritated. That makes more sense. Gastritis, hardly anybody knows what that means. But saying it looks like the lining of your stomach is irritated, everybody can understand that. Another way you can avoid this is, or to make sure that your patient isn't getting confused and picking up any confusion as you're going along in the consultation, is checking understanding as you go. And in fact, this is important throughout the consultation, is making sure that the patient understands before you move on. So you could ask and say something like, is that something you've heard of before? Or, excuse me, would you like me to explain that a bit more? Yeah, so always checking understanding as you're going along. So what are some practical tips? What are some practical ways that you can, strategies or ways you can practice how to avoid using lots of medical terminology? Well, pick 5 common conditions and try explaining them. For example, diabetes or asthma or anemia, excuse me, in 1 minute. And in that 1 minute, you have to explain one of those things in, you're only allowed to use simple layman-friendly terms. Record yourself, listen back to it and revise. What can you improve? So it's a really, really good way of practicing, is just recording yourself, listening back to yourself and thinking, okay, how can I improve on it? It's a really effective way of practicing any part of PLAB 2 actually, is recording yourself and listening back and revising what you can hear. Moving on to mistake number 2. So not acknowledging patient concerns or emotions. This is a big one. Candidates get really focused on diagnosing or completing the checklist that they have in mind, all the data gathering questions, the family history. They get so focused on diagnosing that they miss the patient's underlying fears, like worrying perhaps that they have cancer, maybe, or the feeling that they're overwhelmed and stressed or anxious. And this is a huge problem. This is a huge mistake. The GMC places huge emphasis on empathy, validation, and emotional awareness. And if you ignore or downplay the patient's emotions, you break rapport. And in PLAB 2, that means failing the interpersonal domain. So it's very serious. So how can you fix it? Well, watch out for emotional cues. Look at facial expressions, hesitations, body language. Um, you know, when you're talking to someone generally, you pick up how someone is feeling through their body language and how they're expressing themselves. Um, and you know, their facial expressions when you're speaking to them. You need to be confident enough to pick up on those and respond with an empathetic phrase like, that must be really difficult to deal with. Um, or it's completely understandable to feel that way. There's lots of acronyms that you can use to help you focus and make sure that you're picking up on those and dealing with them correctly. So there's an acronym called NURSE, or it's called the NURSE model. So NURSE, and each one is a step, if you like, to acknowledging those feelings. So N stands for name the emotion. So, for example, if you can see that the patient looks worried about something, name the emotion and ask them, you know, acknowledge that emotion and say, you know, Mrs. X, you seem really worried or you seem quite anxious. Um, and then you let the patient answer. So that's N, name the emotion. U is understand. So you could say something like, that makes sense, given what you're going through or what you've been through. It's perfectly normal for you to feel that way. Yeah. So understanding, showing understanding that, you know, and almost validating that emotion, that can put the patient at ease very quickly. R is for respect. You've done, you know, saying something like, you know, you've done really well to manage this on your own. Um, yeah, so respecting, you know, what the patient has been through and how they've coped and how they've managed to get this far. S is for support. So just telling them, you know, we're here to help, we're here to support you, we're here to guide you and making sure that you know, you get better and so S is for support. E is for explore. Can you tell me more about what's worrying you? Yeah, so you know, showing and exploring and being concerned and showing interest in what's worrying the patient. So that's the nurse module. Sorry, nurse model. Name the emotion, understand, respect, support, and explore. So role play emotional scenarios like breaking bad news or discussing lifestyle changes with a friend. Or again, you could record it and focus purely on how you would respond to the patient's emotions, not just the medical facts. Like, how would you deal with that person's emotions? And use it to gather more information. Remember, you're gathering, this is data gathering, and you are collecting issues. You are getting the issues from the patient as much as you can in this data gathering stage. So never downplay this part of the consultation. Mistake number 3. Candidates usually have poor structure and flow of the consultation. So what happens usually is the conversation jumps around. So candidates will ask a question about chest pain, for example, then jump to smoking, then suddenly explain treatment without a clear order. So there has to be a proper structure to your consultation. It has to flow. Um, you know, and this is a problem if it's not, because a disorganized consultation confuses the patient and it makes you seem unprofessional and unprepared. And in PLAB 2, clear structure is essential. So how can you fix this? Well, I and if you know me from OET and IELTS, you know that I do not advocate sticking to models, model answers, memorizing answers, totally against that. And any good teacher will tell you exactly the same thing. If you have a teacher, whether it's for IELTS, OET, or PLAB 2, that is getting you to memorize anything, memorize, role plays, dialogues, essays, or whatever. Run. Just don't ever go back to that teacher because they're not teaching you properly. You do have to have a structure. And the problem with following and memorizing is that it's a rigid way. It doesn't allow for any flexibility. It doesn't allow you to pick up on patients' emotions and where the patient wants the conversation to go. Because you're so you all you have is this checklist in your head and this structure, this model that you have to follow, that you kind of have to tick. Um, and you're not really listening. It stops you from listening to the patient. So you have to be flexible. Obviously, you have to go through a certain structure. You have to go through all the data gathering stages, asking questions, ICE, red flags, all of those things. You have to take a history, but you have to be flexible enough to pick up on other things that are happening with the patient as well. I will do a separate podcast episode on this because it is in itself a huge topic. But just be aware that you do have to have a structure, but it has to be flexible enough to follow what the patient is saying and picking up on all the things that you need to pick up and then manage in the second half. Um, a few tips I will give on this. Again, I will do a whole episode on this because it is in itself a very big topic. Make sure you signal any transition. So almost what we call signposting sometimes. So if you are going to move on to something else, make sure you tell the patient that before we move on, I'd like to ask you about your general health. So if you are jumping from one thing to another, just tell the patient that, okay, before we move on to the next thing, I just want to ask you about this thing. Or just to summarize what we've talked about before we move on and just checking understanding. So before you move on to the next subject, have like a little transition phrase that you have that you use before you're moving on, where the patient knows as well that the topic is about to change. And again, just practice with different case scenarios, look at the different ways, different structures you can use for every kind of scenario, and just be flexible. Mistake number 4, sounding robotic or over rehearsed. So this is kind of related to what I was just saying about using model answers and memorizing. Where students have memorized perfect phrases, but they come out very mechanical. Sometimes candidates have memorized whole sentences and paragraphs. And like I said, when you do that, you don't respond naturally to what the patient actually says. And why does this make you fail? Why does this cost you marks? It's because PLAB 2 is a test of real world communication, not a drama script. Examiners can easily tell when you're rehearsing lines rather than responding as a real doctor would. Excuse me. So how do we fix that? By learning concepts, not scripts. So learning a structure, but being flexible in that structure, being present and listening. It's as much a listening test as it is a speaking test. I know it's not a speaking test, but you're being assessed on your communication, remember? So communication, when you're having a conversation with somebody, it's not just you talking. A conversation isn't one way, it has to be two-way. So it is as much about you speaking as it is you listening. and adjusting what you need to say based on what the patient says. And practice spontaneous responses, not rehearsed monologues. You're all doctors, extremely intelligent, lots of world experience and dealing with patients up until now. So you need to use that experience and know-how in these tests and have that confidence in yourself. So a practical tip to use here would be to use mock stations to test your adaptability. So get as many mock tests as you possibly can, different stations, and just keep practicing and try to approach the consultation in a different way each time. Have a partner and change the scenario slightly each time so you're forced to respond naturally. Mistake number 5, not involving the patient in decision making. So what happens is a candidate will suggest a treatment or a plan, but doesn't ask the patient's opinion or their preferences. And why does this fail? Why does this, cost you marks? Well, because in UK practice, patients are active participants in their care. Shared decision making is expected in every consultation. So how can you fix this and how can you practice it? So offer choices when possible. So, for example, you could say, Mrs. X, there are a couple of ways we can manage this. Firstly, and then secondly, like that. Or ask for the patient's view. What do you think would suit you best? Or which one would you prefer if there's a choice? Um, and avoid phrases like you should do this. Instead, you should say, one option is XYZ. How do you feel about that? Um, And so a practical way you can put this into practice is, add um, to each station, what do you think moment to every station you practice. Yeah, and make sure you are saying that phrase, what do you think? What's your opinion on this? Yeah. Mistake number 6, not summarizing or giving safety net advice. So you explain the condition, maybe even offer treatment, but forget to recap or tell the patient what to look out for. Without a summary or a safety net, the consultation feels incomplete and could lead to poor patient outcomes, a red flag in real life practice and the exam. So how can you fix it? End each consultation with a summary if you can. Obviously, if you run out of time or if you feel that it is not appropriate or you've kind of summed it up as you've gone along, but try to have some kind of summary. So just a recap, we've talked about XYZ. And try to give a safety net if appropriate. So you could say something like, if your symptoms don't improve or if you get worse, please come back or go to A&E. Use the 3 S's to end, summarize, safety net, say goodbye. It's another good way of remembering it. So final communication tips for PLAD 2. Here are a few golden rules to always keep in your mind. Number 1, be warm and be human. A kind tone can cover many small mistakes. Yeah. So I know under exam pressure, under time pressure, you are focusing on being the doctor and, doing your job, under all that pressure. But you have to remember, and this is the mind shift that's needed, the mindset shift that's needed, that you are in a medical setting. How would you deal with this patient? What is the best way to deal with this patient? Number 2 would be using non-verbal cues. Nod, maintain eye contact, and avoid closed body language. So, when you're listening, show that you are actively listening. Nod your head, maybe even make sounds like, okay, like that. Not interrupting the patient when they're speaking, But just acknowledging, making sounds that acknowledge that you are understanding, you are listening, you are taking in what the patient is saying is very, very important. Number three is adapt to the scenario. Adapt to the scenario. Even if you are someone who has memorized a dialogue, try to be flexible, and adapt to what is happening in front of you. And number four, know the GMC principles. Show respect, maintain confidentiality, get consent, and act in the patient's best interest. And show empathy and understanding. So yeah, that's a wrap for today's session. I hope you found that useful. Um, and just remember that technical knowledge alone isn't enough. How you speak to your patients, how you make them feel, that's what sets you apart. And focus on those things. You already have the medical knowledge. You need to focus on the communication skills and the structure and all the things that we've just spoken about. So I hope you found this episode helpful. If you haven't already, remember to subscribe, leave a review, share it with fellow doctors, your colleagues who are in the same situation as you and preparing for PLAB 2. And you can follow me in the show notes. There's lots of other ways that you can follow me and make sure you don't miss out on the next episode. I hope you found that useful. I look forward to receiving your feedback. And until the next episode, take care and keep working hard. I really hope you found this episode helpful. I always enjoy getting your feedback, so do drop me an email and let me know your thoughts. Also, if there is any aspect of OET, IELTS, or PLAB 2 that you find challenging, then let me know and I'll do an episode on it. In the meantime, thank you for listening and make sure you share this podcast with your colleagues and on social media so more people can benefit. And some parting advice, especially to those who have failed to get the scores that they've needed in the past and are retaking any of these tests. It's not enough to just listen to what you need to do to improve your skills and scores. You must implement the advice and practice. You have to push yourself outside of your comfort zone because that's where real progress is made. Remember, nothing changes if nothing changes. Take care and keep working hard.